Hey, what's up, guys? This is Tori. We are in Unit 11 talking about cellular regulation, and my topic was stem cells. We're doing transplants, grafts, uh, all kinds of fun things that have to do with the origin of a cell and how to manipulate it in the body. So, on the first thing I did was like a lot of people don't know much about stem cell therapy, and so I asked YouTube. And just for the sake of time, I won't play this video, but it made me laugh because for the most part, it's advertisements. Everyone's like, "Oh, it's new, it's awesome. You can run faster, jump higher, live longer," and it's they don't teach you anything. It's go talk to your doctor. So we need to do our due diligence and do research through evidence-based practice on medical journals and reputable sites. So the first question is, what is a stem cell? And it's a special type of human cell that has the ability to develop into many different types of cells. It can be unipotent, pluripotent. We'll get into that, but it's the origin of where cells start and then what they can become. That is a stem cell in your body. The next question is, where do stem cells come from? And it depends on the type of transplant that you're wanting to do, but there's usually three main sources. First is from your bone marrow. It can be from yourself or from someone else, the red bone marrow. The peripheral bloodstream is an interesting one, but it's still fairly newer, and in the research phase. And then for the most part, the best stuff you're going to get is cord blood. Anytime you're dealing with the miracle of life, you have amniotic fluid, you have placental blood, cord blood in the umbilical cord, and you can harvest a lot of stem cells from those sources. The next question are the types, and you can have adult or embryonic stem cells. Adult stem cells are broken down farther into two specific types. So if you have a fully developed tissue like brain tissue or your liver, you can harvest stem cells from there, but they are unipotent stem cells and they will become liver cells or wherever they originated from. And the second type of adult stem cells are induced pluripotent stem cells, or iPSCs. And these are really cool because once an adult stem cell is harvested, they can manipulate them in a lab to become pluripotent. And it's kind of a reprogramming, which is really cool. But that's a whole nother topic altogether when you're recoding genes. So the big thing to remember is that embryonic stem cells are pluripotent, and that's what you want to use when it's more generalized. But when you have a specific cell need, then unipotent stem cells are effective. I like this slide a lot from our lecture. It just shows you can have your blood drawn, and then they separate stem cells from the blood. They're incubated, and a lot of times they're bound to antibodies that are specifically the ones you want for whatever immune or whatever disease process you're dealing with. You always have specific antibodies that are favorable, and they are cryopreserved. You get your chemotherapy or what have you, and then they can be infused back into you. So it's kind of like blood doping for those Lance Armstrong fans out there. He was just like trying to up his hemoglobin, but with hematopoietic stem cell therapy, you're trying to boost the types of blood cells that you want after they're destroyed from any type of cancer treatment that would cause that. This slide is just cool because it shows the importance of red bone marrow, where blood cells originate, and when we're talking about immunity, white blood cells are the biggies, neutrophils, You guys know 60 to 70% of anything that gets under your skin or in your bloodstream, it's attacked by neutrophils, macrophages, and then you can have that femoral immunity or cell mediated, and your lymph nodes and lymphocytes come into play. But so two main types of transplants. You can have autologous, which is coming from yourself, or allogenic, which if you're having trouble remembering that, allo is a Greek word for other, and we are talking about someone else's genes. It's the same species, but you're using somebody else's genes. It usually needs to be matched, and we'll talk about that in a second, but they can come from yourself or from someone else. So in this chapter, we're talking a lot about cancer and the life cycle of a cell, what goes wrong, and how we can kind of manipulate that process by introducing stem cells and producing the effect that we want with the right kind of cells. So I like learning that term, engraftment. After you infuse your stem cells, it's a lot like a blood transfusion. These stem cells settle in the bone marrow and then begin to grow and make healthy cells. That's called engraftment. The risks, of course, are infection, bleeding, graft versus host disease, especially with allogenic treatments, because you have foreign antibodies, and many, many more. And this is just a funny slide. If you have the time, on the left there, you can see common side effects with cancer treatments, and then on the right, hopefully you can recognize that that is graft versus host, acute and chronic signs and symptoms that you're going to deal with. So in my scenario, I just came up with a patient named Jeff. He's in his 20s, was diagnosed recently with leukemia, relatively healthy, no major history of drug or alcohol abuse or anything like that. He's had a round of chemo, and it's just important to know that we do stem cell therapy with blood cancers like leukemias, lymphomas, multiple myeloma, but it's also used in testicular cancer and neuroblastomas. And in this scenario, Jeff's mom was worried about the risks of harvesting Jeff's own cancer cells along with his hematopoietic stem cells. So she wanted to donate her own to help him out. And that's what the family agreed to. And he has had this allogenic transplant for, what did I say, 10 days ago. So you are the nurse taking over. If you can read this to yourself, his vitals are relatively stable. The biggie that I wanted everyone to notice was that on top of his fever and nausea, he has a red rash on his palms and on the soles of his feet bilaterally, which is a big red flag to having an acute reaction to the stem cells. He's on good precautions, neutropenic precautions. He was given Tylenol, and the family is a bit hysterical. So what does the nurse suspect is happening? I just gave it away. We're having an acute host versus graft reaction, and the appropriate course of action, just if you need to pause the video, think about that for yourself. How would you address his immediate need? So care's going to be difficult. We have an immunocompromised patient. Anybody that's on chemo, anyone that's taking any kind of anti-neoplastic, we're just hammering their immune system. So the specific lab that you should hone in on is the neutrophil count. The ANC is your absolute neutrophil count. Anything below 1500 and you're at an extremely high risk of infection. So this case is mild for the most part and treatable, but always should be considered life-threatening, and doctors can prevent acute graft versus host disorder by giving specific kind of medications like steroids, anti-inflammatories, monoclonal antibodies, methotrexate. They got antibiotics like cyclosporin, good meds in there to help with. So we're going to be monitoring labs, eliminating risk infections. I mentioned interdisciplinary communication because it's really tough to help treat people with cancer that are undergoing chemo. So Jeff did have a bad reaction to his mother's antibodies, even though her stem cells were probably healthy, but it's just an increased risk. I mean, it's better if it's a brother or sibling or a twin as ideal, but pretty uncommon. So it's finding an appropriate person to share DNA with it's a big deal, and studies are still being done on that, on compatibility and just stem cell research in general. So it's always improving and exciting. And in conclusion, we're just talking about what we do as nurses, and you need to understand that it's been mostly done in the blood, but we're starting to figure out ways to repair cardiac muscles, cartilage, autoimmune disorders, neuro stem cell research is being done. I mean, any kind of cells in the human body, we're learning how to change for the better, and it's awesome. So take a positive perspective. And like G.I. Joe always taught me when I was a little kid, now we know, and knowing is half the battle. So now you know, nurses.